Before we learn about the different organs and what they do, this is a drawing we typically use to go through the layers of the GI tract at the tissue level. This happens to be the small intestine, but it could just as well be the stomach, and we're looking at the different layers, or the large intestine, as the names of the layers are similar throughout the GI tract, like the mucosa, submucosa, muscularis, and serosa. The specific tissues might vary a little bit. For example, the mucosa is the deep layer of the wall. So we're looking at the layer that surrounds the lumen. Here's the lumen, the inside, the hollow part. Here's the mucosa. So it's a mucous membrane, hence the mucosa. So it produces mucus. And it'll vary a little bit. For example, the epithelium might start off more as a stratified squamous in your mouth, in your throat, your esophagus. But then it will often change to more of a simple columnar epithelium in the stomach and the intestines. But that epithelium is the first part of that mucosa. Then, if we move out from it, we would hit what's known as the submucosa. And the submucosa is typically a connective tissue. It's an areolar connective tissue. It's really just there to hold that mucous membrane in place. It does contain some sensory nerves. It has an extensive network of neurons known as the submucosal plexus. And that submucosal plexus consists of some motor neurons that control things such as glandular secretion. And it also contains some sensory neurons that can be involved in sensing whether there's material in the lumen or not. So that's the submucosa and its submucosal plexus. So the submucosal plexus, or plexus of Meissner, are these neurons found in that submucosal layer. Then we move out from it, and we would reach the muscularis. So the muscularis obviously has muscle. It's smooth muscle that controls the movement of the material in the GI tract. And that muscularis typically is two layers. You'll see here there's a circular muscle layer and a longitudinal muscle layer. In the stomach, there's a third. There's an oblique layer. And that muscle has to be controlled by neurons. So the smooth muscle control is done using the myenteric plexus. My referring to muscle, enteric meaning intestines. So these are the neurons that control the smooth muscle activity, also known as the plexus of Auerbach. Finally, on the outer layer is the serosa. The serosa is just the outer surface of the GI tract. It's known as the adventitia if this was the esophagus, but everywhere else it's known as the serosa. It's a serous membrane, typically. We're going to talk more about the serous membrane found in the abdominal cavity. It's known as the peritoneum. But this is another layer of mostly connective tissue, areolar connective tissue. So those are the layers of the GI tract at the tissue level. The peritoneum is the last serous membrane we learned this semester. So if you think back, we've learned about the pericardium, which is the serous membrane that encloses the heart. We've learned about the pleura, or the pleural membranes surrounding the lungs. The third serous membrane, and the largest, is known as the peritoneum. And like the other serous membranes, there's a parietal layer that lines the inner wall. So on this drawing, parietal peritoneum, they're pointing here, but this would all be the parietal layer on the inner surface of the wall of the abdominal cavity. Then there's a visceral peritoneum, which is attached to most of the organs. Not all the organs in your abdomen are in the peritoneum, but most of them. So you see these are all the intestines here that we've cut through, kind of cross-sectional through them, and you see that they have the visceral peritoneum on the outer surface of them. This is a really interesting mid-sagittal section where you can cut through part of the liver. You'll notice that the stomach is located right here, and behind the stomach we can see the pancreas we've cut through. Transverse colon, part of the small intestines are all kind of sectioned through. Here's a uterus sitting above the urinary bladder. So this is a really good view just to gauge and understand where things are in the abdominal cavity. There are some organs that lie behind the peritoneum. So we call these retroperitoneal organs. They include the kidneys, which we don't see on this picture because kidneys are not sitting right along the midline. They're off to each side, so you wouldn't see the kidneys, but they sit behind the peritoneum. Parts of the ascending and descending colons, those you also wouldn't see on this picture because the ascending colon is on the right side of the body. The descending colon is on the left side of the body. The part of the small intestine known as the duodenum is retroperitoneal. Now that you can see. Notice here we're pointing to the duodenum. That's part of the small intestine that comes off of the stomach. Notice it is in the back. It's behind all these membranes. All right, so it's known as retroperitoneal. You'll also notice the pancreas is retroperitoneal. It's behind these peritoneal membranes. So those are the retroperitoneal organs. Now, the peritoneum is very complicated. It's not as simple as the pericardium and the pleural membranes in that it forms other structures. And we're going to look at these on the next slide. But notice all these small intestines are attached to the back wall of the abdominal cavity, where that peritoneum kind of folds together. And where that peritoneum folds together is known as mesentery. And that mesentery is all this stuff. There's a little bit of fat in it as well. But the mesentery attaches all these small intestines to the posterior wall. The large intestine, where here we're looking at part of the large intestine known as the transverse colon, that peritoneum folds together and attaches it to the back wall. So that's known as mesocolon. It also holds the stomach to the liver. That's called the lesser omentum. There's a big fold that comes down here, comes off the transverse colon, known as the greater omentum. So what those are all part of the peritoneum. They're often folds of it. It's where the peritoneum kind of comes together and holds things in place. All right, you can see how all this stuff is being held in place in the abdominal cavity by the peritoneal folds. There can be fluid accumulation in the peritoneal cavity. Notice there is some space in here, in between the two membranes, in between the serous, or in between the parietal and the visceral, there's the cavity. And if fluid accumulates in that peritoneal cavity, it's known as ascites, accumulation of fluid. These pictures help us better understand, again, these more complicated parts of the peritoneum, these peritoneal folds. Here we have the greater omentum. Notice the greater omentum kind of folds down from the transverse colon and covers a lot of your intestines. The greater omentum has quite a bit of adipose tissue in it. We call that visceral fat because it's attached to these organs. You might call it a beer belly, someone who develops a beer belly, that fat, a lot of that fat is on the inside of the abdominal wall. It's not a subcutaneous. It's not that fat that it can accumulate underneath your skin. It's actually accumulating in the abdominal cavity in this greater omentum. So that's part of the peritoneum. Part of it goes up and divides the liver. It forms what's known as the falciform ligament. So that's part of the peritoneum that kind of separates the liver into these two big lobes. The liver has 4 lobes, but you can usually only notice these 2 large ones. So that's part of the peritoneum. You'll notice the lesser omentum, not as much fat in it as the greater, but it's a membrane. Part of this peritoneum holds the stomach and liver together. Here we've lifted the greater omentum up. We've moved the small intestines. We've kind of pushed the small intestines over to the side. And we can identify that mesentery. That's all this material here. You can also identify parts of the mesocolon right here. So that's all this folding peritoneum that holds everything together. Falciform ligament, greater omentum, lesser omentum, mesentery, and mesocolon, which is similar to the mesentery, except it's attached to your large intestines and holding your large intestines in place. So pretty interesting pictures here showing a lot of the different tissues that hold everything together. Okay, let's begin. Let's start with the mouth and learn a little bit of the anatomy in the oral cavity, and then learn more about what that mouth is going to do as far as your digestive system is concerned. A lot of structures when we look inside of a mouth, but a lot of this stuff we've seen before, at least I hope. When you brush your teeth, you typically want to look around in there a little bit, make sure everything looks good. So obviously you have a bunch of teeth, and we'll talk more about teeth coming up. This is an adult mouth, so you can see the adult teeth. There's also the deciduous set of teeth, which eventually falls out, your baby teeth. But let's look around in here. We have the teeth, we have the palate, the hard palate, and the soft palate. The hard palate is bone. There's 2 types of bone that form it, the maxillary bones and the palatine bones. And then off the back of it would be the soft palate. It's a little bit of muscle in there. And the uvula. That uvula kind of dangles down off of the soft palate. And that's going to help prevent food and drink from going up into the nasal cavity. So we have the palate. We have on each side of the uvula, we have the palatine tonsils. We remember those. Those would be on over here to the sides. We obviously see the tongue kind of lifted upward. That's to show a couple things under the tongue. One, there's a little tissue here called the lingual frenulum, which kind of attaches that tongue and prevents it from falling too far backwards. There are also a couple openings from salivary glands. So these 2 openings are from what your salivary glands known as the submandibular salivary glands. Your gums or gingiva are found covering the sockets, right? So covering where teeth form a joint with either your mandible on the bottom or your maxillae on top. There's other frenula, inferior labial frenula that kind of attaches your lower lip. There's a superior labial frenulum on top. Just kind of holds your lips to your gums. And then you got all your different teeth. We've probably heard the fact that we've got molars and premolars, which do more of grinding and crushing. Canines, they do more of your tearing of food. Your incisors are in the front. You've got incisors, 4 on the bottom, 4 on the top, which do more of your cutting of food. So all things that I think we've seen before, now we can identify them and know their names. Salivary glands. Let's talk about what saliva is. There's 3 big pairs of salivary glands. You have a lot of little ones, but there's 3 that are very large that you can identify on a picture like this. Notice they're all named largely based on location. Here, located underneath the tongue, would be the sublingual salivary gland. A little bit below it, under the mandible, are the submandibular glands. And then back here by the ear is a large gland known as the parotid gland. Parotid actually means near the ear. These glands all secrete a slightly different saliva. We're not going to get into all the differences into these 3, but ultimately they kind of all mix in your mouth anyway. And saliva contains your initial secretions that are going to get your digestive processes going. Those include bicarbonate, which is a buffer. Bicarbonate in saliva is there to buffer the food. We want to maintain a fairly neutral pH in your mouth. And that is for 2 reasons. One, acidity can destroy the enamel of your teeth. We don't want an acidic environment in our mouth. Acidity is very detrimental to the enamel, that covering of your teeth, and it can erode your teeth. You might have bacteria living in your teeth producing acids, so we always produce saliva. Kind of helps, keep that mouth neutral, prevent acidity from bacteria, kind of flushes some of that bacteria off your teeth and down into your stomach where they can be destroyed there. Another reason is one of the enzymes in your mouth works best at a neutral pH. So we like to keep that mouth fairly neutral with that bicarbonate buffer. Salivary amylase is an enzyme. Amylases digest carbohydrates. Carbohydrates found in your breads, in your vegetables, in your fruits need to be digested down into more simple forms, which we call sugars. And salivary amylase is the first enzyme that begins this process. That's the one that requires a more neutral environment. So for this enzyme to work properly, you want that bicarbonate around, keeping your mouth fairly neutral. So salivary amylase digests carbohydrates into smaller carbohydrates. Lingual lipase is another enzyme, but it digests triglycerides. Lipase referring to lipids. Now, this one does not work very well in a neutral pH. It prefers an acidic pH. So this guy doesn't work very well in your mouth. In fact, it's going to work much better when it gets to the stomach, where there's an acidic pH. So lingual lipase, for us, I always say it doesn't really do much in your mouth. It waits. It waits until it gets to the stomach, and then it starts to digest triglycerides. Those are the dietary lipids we have to digest. We digest triglycerides down into eventually fatty acids. That's the end products of your triglyceride digestion. So that's in saliva. There's another enzyme called lysozyme we've already learned about. It's not a digestive enzyme per se. It breaks down bacteria. It destroys bacteria. It can kill some of those microbes that we ingest every day. And then finally, you can find some antibodies. IgA antibodies can be found in saliva, which again, that's also part of your immune system. So those are the main kind of ingredients, if you will, in saliva that most importantly start your carbohydrate digestion. That's really the only nutrient we start to chemically digest in our mouth. If you've ever heard of mumps, mumps is an infection of salivary glands, specifically this parotid gland. Mumps is caused by a virus, and the virus likes to hang out in the salivary glands, and they can swell. You get these large salivary glands. You don't hear much about it because we have a pretty successful vaccination program against mumps. How do we stimulate these guys? A lot of the digestive activities we're going to talk about are stimulated by parasympathetic neurons, right? Remember, parasympathetic system is rest and digest. So organs involved in your digestive processes are stimulated usually by parasympathetic neurons. They can also be stimulated by hormones. And salivary glands are innervated by two cranial nerves. The facial nerve, which is cranial nerve 7, and your glossopharyngeal nerve, which is cranial nerve 9. Those two nerves contain parasympathetic neurons that stimulate your salivary glands. They increase stimulation when you start to think about food. We call that the cephalic phase of digestion because it pertains to your head, cephalic. But when you think of food, you start to smell food, when you maybe even see food and then taste that food, these neurons really stimulate those salivary glands. Here's a tooth. A tooth has different parts. A crown, which is covered with enamel, has a neck and a root. Obviously, it's sitting inside a socket in either the mandible or the maxillary bones. That enamel is what we really need to protect. It's very, very hard material that protects the dentin, which is the calcified connective tissue that forms your teeth. We've learned about gingiva or the gums here, and we don't want that to erode or get inflamed. That's called gingivitis. Inside of a tooth, there's the pulp cavity. Inside that pulp cavity, you'll notice that there's neurons and blood vessels, and there's these little canals called the root canals. And if these get infected, we typically need to do a root canal. There's some ligaments in here that hold that tooth in. The periodontal ligaments help anchor that tooth. So if you're going into dentistry or you're going into dental hygiene, these are your babies. You'll need to know a lot about them. For us, if we're not going into dentistry, we can kind of sneak by knowing some of the basics like enamel and dentin and the root canal. And the numbers of teeth. So here are two sets. We've got the deciduous dentition, which are your primary teeth, aka your baby teeth. And if you count, you should count 10. There are 10 baby teeth. And then when we replace them typically with 32 permanent teeth. And this just tells us all the different ages that they come in. I'm not going to hold you to that, but you should know 10 versus 32 permanent teeth. Each tooth in an adult set is given a number. 1 through 16 are your upper teeth, and then 17 to 32 are your lower teeth. You can see that you've got your incisors, central and lateral, canines, and then your premolars and molars. You've probably heard of wisdom teeth. Those are the ones that come in last. Those are your third molars way in the back. All right, next video, we're going to kind of use this as a review in the next video. Kind of just go over, summarize some of the activities in your mouth. And then we'll move on, because once you chew that food, you're going to have to swallow it. So we're going to have to see where that food goes next.